So, Namaskar everyone. My name is Dr. Manish Yadav and welcome to my YouTube channel. Today we're going to talk about something very important topic, and that's colic. When we talk about acute diseases, and in acute section, especially one of the most important section is colics. Colics when come, they come as a storm. And if they go, either they go it or you have to refer the child or the patient. And I'm really excited about this talk because managing colic is really an art, So I will start. What I will do is that I'm not going to talk a big length on this lecture, but I'm going to give a gist of it. I'm not going to talk about going deeper into the remedies, but I'm just going to give you the snippets. Because when colic comes in front of you, you don't have too much time to think. So there are some basic remedies. If you remember it properly, with few fingertips indication, then you can definitely help majorly of many of the patients very easily, even on phone, in person, or long distance, anyhow. And that's how I've been managing my cases. But of course, the importance of properly taking the acute totality, the cause, the location, sensation, modality, concomitant, which we have already spoken about, doesn't go away. But yes, there can be a time when you are in a fix, you get a call and sudden cramping and colicking patient is in front of you, and you have to look and just think and prescribe. So for that, I will share you a few remedies which has helped me a lot in my practice. And especially I will share the remedies which I have used very successfully. In conjunction to that, I will also use the other associated remedies which I have learned from my teachers, masters, and my books. So let me start with a case, colic. We talk about colic, so I cannot forget this case of Dr. Sunilmar Sarkar sir. As you all know, I'm a student of sir, and I was like blessed, to work under him for a long time, and still I'm in communication with him. So I can tell you about one case which I saw at the Other Song Academy when sir used to come there. This was a patient. This was a patient of uterine cancer. It had metastasized, it spread all over. It was a very complicated case. All the therapies were done and extra things. There was no scope of this patient to live, and kind of incurable case. But the problem was she was in a lot of agony, a lot of pain, severe pain, and it was a lot of cramp and colic used to come in the entire region, uterine region. It has spread to the abdomen, liver, many places. And the pains used to be so bad that she used to shriek, and continuously pain used to be there. In spite of taking morphine or tramadol or other analgesics and other helps, the pain did not subside. So patient came, she lay down. Sir was examining her, and he kept on asking all the questions about location, the sensation, the modality, how did it start, everything. And he was just observing the position of the sitting. She's lying down, she's bending about, taking the knees ahead, all those things he's asking the sensation he's asking about, is it twisting, is it burning, is it pricking? And watching. Suddenly he asked, patient said that I cannot eat or drink. And then by asking in the interview, it revealed that whenever she drinks water, it rolls down. And it causes gurgling sound. So he confirmed again. He said, are you sure? He said, yes, when I drink, I feel the pain. It's going like this. And that was the keynote indication of a remedy. And then he only asked, of course, there was no need to ask. We could see that it was a spasmodic pain. The pain used to come, pain used to go, pain used to come, pain used to go. And this remedy, the remedy that he gave was cuprum metallicum. At that time, we gave cuprum metallicum 200. And just with 200 potency, I think within 15-20 minutes, the entire pain abolished. It went off completely. That was my first case where actually I saw a severe colic in front of me, which got ultimate relief and instantaneously relief from homeopathic medicine. And this case, I have a recording of this case before and after both. till now. I show it to some of my students, just to boost their motivation. And that was a case which gave me so much confidence that I said, no, if I know the remedies, the few remedies, then sir told me that I learned the few remedies by heart, fingertips. Remember it, few indications on your fingertips. And these remedies will help you so much so that this kind of result you can also do it. And that motivated me to read more, study more. And of course, now I also have got similar cases where I have innumerable cases I have been able to relieve only because of the homeopathic medicines and products. So we start with, I will come back to Cuprum later on, but this was just the beginning of the case. So I said, let's start with the blessing of myself. The first remedy that we think about, as I told you, I'm just going to give you the snippets. Not going to talk deep into the remedies, dive into the remedies. Okay. But yes, if you listen to me carefully, you will get a gist of studying Matra Medica and what to see and how to see in the remedy. The first remedy that we talk about is Polusin. The first remedy is Polusin. You have to remember Polusin in and out. Now, this is a remedy that we always learn in our college. So, what are the symptoms of it? The symptoms are basically bending double. We know this. Bending double is the most important characteristic symptom. And Polusin is a remedy where you will find a lot of GIT tract disturbances. Means patient will have vomiting, patient will have diarrhea. Maybe, how did it started? You don't know. She went out, ate something, food poisoning happened, and sudden pain started happening, twisting, colicky pain. But the characteristic thing is bending double, right? But there is something in this bending double also. Now, what is in this bending double? Because there are so many remedies which has got bending double symptoms. So the keynote symptom, the actual modality of Polusin is not just bending double, because I can tell you innumerable remedies have got bending double. If you just go and let me show you something. Okay? I will show you something in repertory, and from there we'll go ahead. So this is just an exercise to learn, right? This is my repertory. Yeah. So if you go in repertory, go in bonding awesome, go in abdomen, go in amelioration, you look for bending, forward, bending, forward, sims. Bending forward, there are only two remedies, belladonna and magnesium. Polusin is missing there. Okay. So what do you say about this? So actually it is not bending double. Let me show you exactly. You have to understand this. If you understand this, your life will become easy. Let me open NASH. Polusin chapter, or I can open Alice Code also. So let's go into Alice Code. Now, if you remember my earlier lecture, what did I say? I say that remedies when you read, now look for the bolds and italics. So let's read the first sentence. What is written? Agonizing pain in abdomen causing patient to bend double with restlessness, twisting, this and this, amelioration by heart pressure. What is in bold? What is in bold? Causing patient to bend double and by hard pressure. So what is happening when the patient is bending double? And see, amelioration underline. So what is happening when patient is, it's not just bending forward. The patient is just bending forward. That is not bending double. Bending double actually means it doubles up. Means what? Actually, it's not about bending double. It's about hard pressure. Hard pressure. So the keynote modality of actually Polusin is hard pressure. And this is a generalized symptom. This is generalized symptom. You will see this in everywhere. Means you will see this in neuralgia. I have cured severe eye neuralgia or vital neuralgia with Polusin because patient said, I press it with so hard. Like, you press it so hard. That is hard pressure ameliorates. So when neuralgia and hard pressure, Polusin is a remedy. That's why you will see somewhere in the sciatica. Let me show you. Yeah, it's true. So if you see sciatica also, even in sciatica, you will find that the patient gets better only by hard pressure. Let me open it today. Where is it? So you have contraction, this, stiffness, but hard pressure ameliorates. Look at this amelioration, hard pressure. Okay. So remember this. So the keynote feature which you have to remember is, so if you see a colic and patient, when you look at patient, proper modality you take and patient, you can understand that it is the pressure out of everything. Patient will say so many things in acute, but out of everything you have to pick up which is the most important modality, amelioration, and it is hard pressure. When it is being pressed very hard, patient gets healed. So number one is this. Second is, it is a remedy. Let me show you NASH again. I wanted to show you in NASH. NASH is a very good book. Actually, everybody should go and read NASH Therapeutics of Colosseum chapter. Let's open NASH. Where is NASH? Yeah. NASH Therapeutics. Now see what is written here. First sentence. Disinclined to talk, see friends, impatient, easily offended, anger, indignation, colic, or other complaints as a consequence of it. Means it is a remedy. Actually, when you talk about physical aspect, other than physical aspect, it is a remedy where he's a very sensitive guy, and there's some trauma happened, some conflict happened, some fight happened, because of which he felt indignated, he felt anger, exactly like Steffi said. So you will get, when you ask the patient, how did it start? Where were you? What happened? Which I explained in the earlier chapter. Earlier talks I said that acute disease, always there's a cause. So mental cause, you might get this mental cause in many of the cases where you'll see a lot of anger, a lot of indignation, a lot of humiliation, or some fight, arguments, trauma happened just before the pain started. So anger, humiliation, indignation. This is something very crucial that you have to remember about Colosseum. So these 2 points, always remember the hard pressure, because bending double, hard pressure is generalized. It might be neuralgia, it might be sciatica, it might be anything else. And GI tract disturbance, the entire tract is disturbed. I mean, it is a very pathetic case. Like you will be scared. You will just want to admit the patient in hospital. You can save so many patients from there. Means just imagine, patient is vomiting, patient is diarrhea, colic is there, continuous pain, and then pain is continuous. Only position relief is bending double, and it's not just bending double, hard pressure. Or the mental cause of anger, humiliation, you might see, where you can think of staphysagria also. What is the next remedy that you think about? After Colosseum is the remedy that you think about very close is magnesium phosphoricum. Magnesium phosphoricum as Colosseum is also neuralgia. Both have neuralgias, and we have read magnesium phos and Colosseum differentiation so many times in our colleges. What is the key point of differentiation between Mac phos and Colosseum? What I would like to say is, what I have understood, Mac phos, it's not hard pressure. There's nothing to do with hard pressure. Yes, pressing ameliorates, but they will not want hard pressure. Number one. Second, transit relief might be there with the pressure, but they will not emphasize on hard pressure. They will emphasize more on warm, putting hot bag, putting warm. Okay, warm. They want warm, like arsenic. Okay, arsenic also wants warm. So magnesium phos is that remedy. Another thing about magnesium phos is, which you can remember is, it is an actual good remedy for neuralgias in the lower tract where maybe dysmenorrhea, especially neuralgias and dysmenorrheas. And it does not have action on the muscles of the intestinal tract. What do I mean? Generally, you will not find magnesium phos along with diarrhea and vomiting. Means GI disturbance is not there. Majorly, their affection is on the nerves of the uterus or lower abdomen or superficial, not internal. So internal tract will not be damaged, or internal tract symptoms are rarely there where MACPHOS is used. So MACPHOS generally you will find in places where vomiting, diarrhea is not there, or especially in dysmenorrhea. How do you differentiate that? How do you know that? You know this with the tongue color. So whenever you are in confused mind, look at the tongue. And if the tongue is coated, it means there is GI disturbance. Always remember. there is some action or some disturbance in the GI tract, hence your tongue is coated. If tongue is clean, it means there is no complaint in the GI tract, in the circulatory muscles, in the entire, contracting muscles of the GI tract. There is no problem. There is no hindrance. So if it is clean tongue, MACPHOS. If it is coated tongue, you can think of colicin. Great. Another remedy that you should always keep in mind is diasporia. Diasporia, if you go in boring, it is written bold. It is written gallstone. It is actually a remedy for gallstone. I have got few patients of gallstones where I have been able to help them with their pains, and of course, few patients I have been able to help them completely get rid of their gallstone. But I'll tell you, managing pain of kidney stone and gallstone is so challenging, but it is so thrilling, so thrilling. If you cure or if you just get relief, give relief to one gallstone patient, one kidney stone patient, your confidence goes very high. And that's a great satisfaction and great confidence building in you and even in patient. So it is the first time we think of gallstone. Now we know about diasporia for gallstone. But what is the symptom of diasporia? Diasporia is also a very important remedy for colics. And we know that diasporia is a remedy where the amelioration is bending backwards. Bending backwards. But in my small career of homeopathic practice, till now I have not seen any patient of colic who I have used diasporia to a great relief in kidney stones, in gallstones. Amazing results, amazing. And all the cases that I'm talking about, I have got all videos and follow-ups, okay, which I can show, which I always show to my students in the class when physically reading. So diasporia, definitely the symptom is bending double. Okay, let us go and read. If just have to see what is written in annus cavum. I will give you something very important today. Diasporia, annus cavum. Bending double. So if they bend forward, there is aggravation. Amelioration is motion, walking difficult, compelled to walk even though tired. Right? Generally, here it is written lying down. But in colic, let me show you. Now, see here, this is the catch. Okay, this is what I want to say. It is written aggravation lying down and doubling up. But I have cured diasporia patient only on the symptom of lying down. And it is written lying down is aggravation here. How do you understand? How do you understand? So when they're saying lying down means in colicin, what happens? Patient lies down on the side, on the back, and it lies down and bends his feet. That lying down they're talking about. But in diasporia, the problem is, the amelioration is stretching backward. What is stretching backward means? They want to keep this intestine muscle straighten up. So actually they will lie down. Actually they will lie down very tight and straight like this. This is stretching ameliorates. They will not come and stretch. Just imagine patient with colic, severe colic, and he's stretching. No. They will lie down. But it is not the lying of the colicin. Remember that. Understanding the difference. So when you see aggravation from lying down and it is written aggravation from lying down, they're talking about colicin the way the patient lies down. Means here the patient wants to walk. Even he's tired. That's what it is with. They want to walk. They want to move. Why? Because when you walk, when you move, or when you stand up, what happens? Your intestinal or stomach abdominal muscle straightens up. It stretches. So it is stretching ameliorates. So when patient is like this, pain is there. Patient is like this, pain reduces. So hence you will find diasporia patients are they're lying. They're lying down, but there's an area stretch. Another thing is the pain is very specific, especially the location is umbilicus. Remember that. Umbilicus in and around. And it is written exactly as if twisted by hands. And I have got a patient where he actually said that somebody puts the hand and it twists the intestine. Now, this thing you will not find in colicin chapter. Okay. Remember that. You will not find in colicin chapter. Colocin patient, the focus is not on the character of the pain. The focus is on the amelioration. Diaspora, focus, intensity of the character of the pain. Twisting pain, it is very clear, it's not confusing. Patient will say as if intestines are twisting, as if somebody has put hand, grasped and pulled. That's what it is. And they will be lying down. Remember that, the way lying down, okay? Stretching, remember that. What else? Now, we talked about in Colocin, the disposition. The Colocin disposition is anger, humiliation, indignation, trauma, conflict. What is the, what is it? Diaspora. What is the disposition of diaspora? Now, why I'm saying this symptom? Because when you look at the symptoms,